Hello everyone. Today is August 7th, 2020. I wanted to give you an update on the progress of the stroke or TIA or whatever is going on inside this little head of mine. And I had an MRI completed and we are just waiting for the results, which should be into the doctor's office today. Okay, so a little recap. Sometime during the night of June 5th, I demonstrated difficulty breathing and told my husband I needed to have my inhaler. So at this point, he went to get the inhaler from the kitchen and I collapsed in the hallway. We didn't realize what was going on at the point until we contacted the not the MRI, the ambulance, and they told me to use my nebulizer, go to the following day to the emergency room. So, under advisement of that, we went to Henry Ford Wyandotte Hospital, of which they told my husband to leave, and they wanted to keep me for 30 days. The reason for their keeping me for 30 days, because we are under this COVID-19 pandemic, they wanted me to have an MRI scheduled the following morning. They did a CAT scan, an ECG, a lot of blood work, and all the test results from Henry Ford came back normal. The brain scan is what they wanted to keep me overnight for and admit me, and when my husband told them that he needed to be present with me, they refused him and told him to leave the hospital. So, from what my memory can understand at this point, I'm pretty sure that was a violation of my patient rights. Being one that I was incompetent, could not make decisions for myself, and really was in a world of which I didn't know anything, but I did know that something was affecting my Broca's area, which I kept telling them the Broca's area, and I kept telling them that it was in this area here. However, the doctor at Henry Ford Hospital did not want to listen to anything, and he just wanted to admit. When he had called my husband asked if he could come up, and the doctor told him no. They would call him within an hour or two to let him know what was going on. Now, mind you, they could have done anything to me at this emergency room, and the fact that I had a female Muslim doctor who treated me initially and was just waiting for the test results to come back, and when they came back, she said that I would more than likely be able to go home. Following this, the other doctor, Dr. Brian something or another, had determined that I needed to stay. He told my husband, when my husband said that, he didn't want me to stay in there because of the virus, that we would go home and take an MRI, somewhere else. So, when my husband had told him that, the doctor asked him what kind of family we are that allows a patient or a loved one to go home instead of staying in a hospital for a stroke or a TIA. Well, for starters, the test results are normal. The ECG showed nothing as far as cardiac activity being impaired. The only thing that was impaired was my speech and my memory. So whatever it is going on, hopefully we'll be able to rule out everything else and come up with a conclusive determination of what the actual diagnosis is. Then we can proceed further. They wanted me to have physical therapy for left upper and lower weakness in my arms, which I do have, but that is associated with something else. It has nothing to do with the stroke or TIA. Daily, I am doing better. I have a routine that I'm trying to adhere to. Things are getting like mixed up. I don't know where I am. I'm lost all the time. It's a really big struggle going on inside of my head because it's almost like I am an empty shell. I know what's going on around me because I can see it, but I don't know how it's coming to be like that. For example, my husband was doing some memory games with me yesterday. We were playing with Monopoly Play Money. He told me to count it, and I counted it within seconds. How I did that, I have no clue. But apparently, I used math, and I just put the 1s, the 5s, the 10s, the 20s, the 50s, and the 100s all up in a top category. And then I counted them out. Each one. The 1s had 13, or the 5s had 3 or 4. So I counted them out like that, and then I added them together, multiplied, which seemed to work out pretty well. So my mathematic skills are pretty good. We did that quite a few times. Now, the other memory games that he was trying to give me was we were using a deck of cards, and he wanted me to flip the cards over to locate where the joker was, or a queen, or a king. At first, I didn't even know what the cards were. So he began with, is this a man or a woman? So with the kings and the queens, there were men, there were women, but there was also a noticeable boy who was the jack, of course. I'm sure you guys all know that. As far as the shapes on the cards, I could not determine what a diamond shape was. I could, however, tell that there were 2 triangles put together. I kept saying that it was a square or 2 triangles or a rectangle, so I'm having a little bit of problems associating the shapes. Other things are, I'm trying to make myself active and planting a little bit here and there, but because I have the spinal problems and muscle atrophy and breathing and all of that goodness, yeah. Okay, well, anyway, this is what happens to medical people who take care of everybody else and forgets to take care of themselves. Bad, 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 bad. But anyway, even though you do take care of yourself, which I can say that I am half and half, anything can happen. And basically what's going on with this COVID virus is they are forcing people to either stay inside the hospitals or they're telling them to stay home. So, refuse to be treated at a hospital. I do recall somebody had mentioned something about not being able to get dialysis. These are life-threatening conditions, as was mine on June 5th. Hello, couldn't breathe. Lost oxygen to my brain and lost consciousness. Now, in the event of somebody being on dialysis, if they can't get to have their blood transfusions and, recycling or whatever it is that goes on there, if they can't get that, it is a life and death situation. So, we as individuals have to take care of ourselves. We cannot count on anyone else. In fact, I made a joke with my husband. I told him, are you taking care of me for your benefit, or are you taking care of me to benefit me to get myself back to each other? The Smarty Pants answered with both. But that is okay. He is doing it. He is doing a wonderful job, and I appreciate it very much. He's doing it all by himself, and I know he's getting overwhelmed because I've been there, did that, and treated patients before in the same situations. So, leave some comments, feedback, whatever. And I would say for others who are suffering from prior stroke or anything like that, just keep trying. Don't give up. Your brain is going to be so frustrated that it literally you want to like pull it out or something. At this point, not knowing who I am, not knowing where I live, where I'm going, doctors telling me I can't drive right now. Um, I don't know what's going on next, so I'm taking it day by day. It has to be a slow process, and it also has to be a fast process because it is dealing with the brain. I can't remember current things. That's one of my problems that I'm having right now. I have my past memories up until I was about maybe 35. I can recall those like in a blink of a second. Um, if I am walking around the neighborhood or just going for a drive or something, I notice that I'm looking at everything, and half of it I don't even know what it is. Um, that kind of makes me sad, and being that I already have anxiety and depression, it's going to affect that as well. So I am trying to keep myself positive and happy and listening to music and keeping myself active, surrounding myself in nature, and just doing the best I can do. On a daily basis, I take potassium, half a pill of zinc, and vitamin D3, 2,000 units, and 81 milligram baby aspirin. In the evening, I take a 500 milligram magnesium and black cohosh because, hello, it is that time. And it decreases the mood swings a lot. It decreases the, how do you call that? Hot flashes. Yes, hot flashes. It decreases the hot flashes significantly. There have been studies from what I've been reading, but no conclusive evidence that it is, I don't know, for the black cohosh. They haven't concluded that it is actually, beneficial for menopausal support. But that's okay. So, anyway, I know I'm probably jittering all over the place with the words and trying to get things out. And this is usually what happens when I'm talking. My throat will get severely dry. I'll be getting a little bit of a cough, but that's from me being a smoker, bad habit. And I also have sinuses, so all that crap is draining down on me. And bronchitis and COPD. Yep, all that goodness. But anyway, the humidity here kills me as far as asthma wise, and I'm sure it's affecting a lot of other people, as well as the seasonal allergies. But just do the best you can to get your life back to normal. If you need help finding something, don't be afraid to ask. Even your neighbor, I mean, seriously. You're good friends with your neighbor, or you can't do something in your house if you're home alone and you don't have anyone to help take care of you. Call your neighbor and ask her, hey, say, or him, I'm having a little bit of problems. Would you mind coming over for a minute and helping me? It doesn't hurt to ask. And my neighbor is awesome. I am telling you, awesome. She works in urgent care, and she's been continuously going. She is a superhero, going to school for healthcare administration, and she is also raising 3 children and working full time and taking care of a family. And this is a young, under 30 girl who is a superhero, super mom, and super care person. She's wonderful. Thank you, Ash. Love you to death. Okay, so, like, that's it for this video. See you soon.